What starts with studying Sniffy the rat can evolve into running a trauma therapy practice. Lauren Cavati's journey shows us how foundational learning translates into innovative mental health services. Professionally Psyched is the podcast that brings you cutting-edge psychology research and real-world insights from our psych community of clinicians, researchers, and educators alike. In our special alumni spotlights, we chat to graduates from our psychology degree programs about how their skills learned in the classroom have become powerful tools supporting diverse career journeys and successes. Hi everyone and welcome to Professionally Psyched. I'm Jessica Muller, PhD candidate in Public Health at James Cook University, and before we get started we'd like to acknowledge the custodians of the land on which we record, and for me today that's the Bindal and Wulgurukaba peoples. And I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples and cultures from wherever you may be tuning in from across the country. In this alumni spotlight, Dr. Amanda Krause speaks with Lauren Cavati about establishing her own EMDR-focused practice in Townsville. Discover how Lauren's learning and behaviour coursework still guides her understanding of client presentations. So grab your headphones and get ready to get professionally psyched about staying connected to the theory that makes your practice effective. Enjoy.
Lauren, thank you so much for joining us on the podcast today. To start, would you please introduce yourself to us?
Absolutely, Amanda. Thanks for having me. So my name's Lauren Cavati. My title is that I'm an accredited mental health social worker and director of Deep Speak. So I have a private practice in Townsville. We do face-to-face and telehealth phone sessions as well. So that's my current role.
Excellent. And I imagine there might have been a little bit of a journey from your undergraduate to getting to the point of having your own private practice. Can you tell us a little bit about how your journey has evolved?
Absolutely. That's a great question. So my undergraduate degree I completed in 2012. And then from there, I actually got my first job in community services in an NGO, Uniting Care Community, amazing organization to work for. And I worked there for 8 years total. And in that journey, I learned lots of things because I worked in different roles in that organization. Started off in a therapy role, creating and facilitating a program which was for young people who had a parent with a diagnosed mental illness or psychiatric disability. And so that program was a group-based program, ages 8 to 18, 2 different groups. And the program itself was a 2-year program. So you worked quite alongside those families for 2 years. And so from that role, I was in that for quite a few years. And then I had my first little baby boy. So I was on maternity leave and came back and went in more to a supervisory role where I was supervising clinicians. So that role, I think they called it a service leader back then. And basically I was supporting different programs that had funding for different therapeutic interventions. So there was, I think, 3 or 4 programs that I was supporting, and that required me to support the team to meet their goals of the funding, but also provide support to them in their roles to do what they were doing best as well. So a lot of supervision with those staff members and things like that. I was in that role for quite a few years. I was also doing on the side, when we were activated, the Lifeline Community Recovery. Just when there was a natural disaster, I would sometimes get deployed to help out in community, providing psychological support to those affected by a natural disaster. And in the 2019 floods, I was actually given the huge responsibility to create a program for it was like a case management based program for the floods. So I had to get that off the ground, pretty much just little me. So that was a big venture, but that program involved lots of practical and psychological support to victims of the 2019 floods in Townsville. And so we would link in with other services as well to make sure people were getting what they need. That was an amazing program, and that was a part of like a suite of the programs that I was managing. So worked in the NGO for 8 years. And it wasn't until I went on maternity with my second little boy, I didn't know what was going to happen after that, to be honest, because I had a great organization that I was working for, and I could have easily gone back. But I think the drive to work in private practice was led a little bit by my wanting of making decisions around my family. And so when I was on maternity leave in 2020, actually, which was a very significant year that everybody knows about, in 2020, I was on maternity leave and I thought, I think I'm ready to do something of my own, in my own way. It's great working for big organizations, but you don't have a lot of ability to make huge systemic changes within that system. You have to, there's certain processes to follow and things like that, which is fine. But I kind of wanted to be my own little change maker in my own little way. So creating my own service was a very exciting but very scary thing to do, because I don't know how it's going to go. You just kind of go, well, I'm just going to do this now. And I remember the day actually when I did that. It was 27th of April 2020, and such a random year in itself. And I just sat there and went, I think I want to do this. And I think I want to do this. And something was big enough in me to just create that day. I remember creating the ABN and the name, and then it just sort of emerged into the real world. And I went, okay, I'm going with this now. I'm gonna have a private practice, and we'll just see how it goes. And DeepSpeak, the name DeepSpeak came to me because I thought, well, it was always something that I felt quite good at. Like I could help people get to the, not just talk about the surface level things, we could get to the bottom of things and speak about things in a real way, the real stuff. So DeepSpeak kind of just came to me and I went, that's definitely what I want that practice to be about, where people really bring in the real stuff and be vulnerable. And I started off from home, actually. It was a home-based service. And then I was doing a bit of mobile work and telehealth because 2020 COVID. And I had a little room in my rental, which was really quaint and cute. And, I loved it. I was really proud of it. And, and clients would come and see me there. And then I got busy. Word of mouth traveled and it was amazing. And it was one of those moments where I was like, wow, this is, the community's backing me. Like this is a moment where, this beautiful dream that I have just became reality. So I guess my initial creating DeepSpeak evolved in a way that I didn't expect myself. I ended up getting to a point where I needed help and getting staff on board and to where we are now. We've last year we made the big jump into a beautiful space on Tharangao Drive, and we've got a team of 7 now. So it's been a wild ride, but we now have 4 of us clinicians and 2 admin and a psychology student who's a volunteer actually. So she'll be finishing her, I think she'll be provisional psychologist next year. So we've got a beautiful little team now. I mean, that's a fast forward version of my journey. There was lots of ups and downs along the way, but that's kind of where we are today.
That's an amazing journey, and what a great growth from starting out as you into a team that you have built with DeepSpeak. And I love the name and the meaning of the name. With DeepSpeak, do you work with a certain clientele?
We work with 15 and above, so we don't work with young people, but we work 15 and above is our age group, and we work with various streams. So we have fee-paying clients, so clients that pay full rate if they choose. We have mental health care plans that we accept where there's an out-of-pocket cost as well. All different types of people in those groups alone, and then we have work cover clients, victims assist, and UAS. We used to do a bit of EAP work, but not so much these days. And we also do veterans, so work with Open Arms and Bupa Open Arms as well. So they're pretty much the main streams that we work within. And in amongst those streams, a broad range of different clients and different presentations of things that they're wanting to work through. One of our specialties here, which we are known for and we love, is treating trauma. So we love to work with EMDR therapy, which is a focused psychological intervention, but requires basically that treatment itself treats traumatic memories. So you desensitize the memories and you also install new cognition in the memory network. Very effective treatment, and we get some beautiful outcomes with our clients using that treatment. So that's kind of a definite passion area for us, where we would love to help people change not just the way they think, but the way that they feel what they think, because memories, unfortunately, have a lot of data stored with them. And that's half the challenge when we're doing CBT with somebody. We're working, I like to sort of, the metaphor I'll use is when you put those Mentos in Pepsi or Coke and they explode everywhere. A lot of treatments we find work with the bubbles, and you're constantly working with the bubbles, but often the challenge with that is the bubbles are coming from trauma, and trauma is the mentos, and that is the thing that we like to focus on here to change the way that the person is experiencing their world based on what they've already experienced by treating their trauma memories. So yeah, so that's pretty much a snapshot of what we do with different streams of clients. Very passionate clinicians here, and everybody here is quite trauma informed and trauma focused.
Hmm. And I think with something like EMDR, which might sound unfamiliar to clients, I suppose you all have had to do quite a bit of the research to underpin which treatments you're using.
Yes, absolutely. EMDR specifically, you can't train in unless you have a certain level of qualification. So that treatment isn't one you can just go and train in unless there's a certain qualification that you have. And also with the other treatments as well, all those treatments require training to implement them. With new clinicians, we provide a lot of supervision around that so that they can constantly check in about how they're going with those treatments and making sure that, yeah, they have that confidence in themselves and clients. And to do it for myself, because a lot of people don't understand accredited mental health social work. It's not a very well-known term in the industry, but to be where I'm at and do Medicare services, one of the pathways that psychology can branch off into is doing mental health social work accreditation. So I missed this out, but I did a master's in social work. And then after that, did my 2 years in the field of supervised clinical interventions with focused psychological strategies. And that allows me to be registered with Medicare. But yeah, so to be able to do those treatments, yes, you need to be qualified and do the training, and everybody continually seeks and accesses supervision to make sure that we're doing the best we possibly can in our industry with our clients and in the community.
So I know that you do a lot of continual professional development, but if you could take your mind back to your undergrad, is there
Yep.
anything from your undergrad knowledge, skills, subjects that you really draw on still today?
Learning and behavior was a standout one for me. I loved that subject and it still applies. A lot of when we're working with a new client, we're always trying to understand why their behavior is the way that it is. And it isn't just by accident. It's based on programming, it's based on what they've learned, it's based on how they've been treated in the world and their childhood and from a macro level society and the different systems that they're in. And there's so many layers to that. So learning a behavior, I remember doing experiment Sniffy the rat. I don't know if they still do that in psych, but it was this like little rat that you programmed on a computer and understanding like repetition and what the rat was expecting. And we're pretty much the same. We're all, animal species. And so learning behavior was a great subject for me to learn about. And psychopathology definitely helped me too, in terms of understanding and assessing clients' mental health and what's going on for them specifically. And so I do use a lot of screeners and to understand, what kind of presentation a client has, whether they might meet the criteria for PTSD or depression or anxiety. And I recall psychopathology was quite a good subject. The degree itself is rich in knowledge. And I think for me, when I finished my undergrad, one of the things I will say was helpful for me to learn was that I didn't know everything. I came out and I knew all of this amazing stuff in the degree. And I thought, oh, gosh, I just did my undergraduate in psychology. And coming out into the industry, I remember getting humbled quite quickly, realizing, oh, I know all these things and I've read all these books, but actually I'm working with people. And so there's a process, I think, for every person in this industry where you have to realize that growth is continual and that the degree has a great structural foundation for us, but there's a lot more to do when we get out there in the field and learn.
I think that's a really important point, that we need to have that growth mindset and that we are still growing and the degree isn't the end point, it is a starting point for our careers. So in thinking about career advice, do you have any advice for the up and coming psychology graduates?
Sometimes when you graduate, one of the things that can be helpful is to go and work in an organization. An NGO is great too, because I think one of the things that's different about private practice for me, which I wouldn't understand if I didn't work for an NGO, was that there's different client groups as well, different client groups you're working with, and there's different things to understand as well about community and about all, because in private practice we don't get a lot of chance to link in with community services. That's unfortunately not how our service works. It's different. And I'm so grateful that I went out into a community-based role and understood the community, understood the different services out there, understood what they did, linked in with them. You know, there's a lot of collaborative approaches in that space. It's a really rich in knowledge area. So I definitely recommend that new grads be open to going out into these areas and learning in those spaces, because there is a lot to learn. And I'm so grateful for the fact that I did do that. And it was an amazing experience also. Even when I'm referring clients, you know, I think about all these services that I'm aware of, and I wouldn't know those services if I just went straight out into this sort of service. It's different. So I guess probably my main advice is be open to learning and growing, understand your community, go out into roles that hopefully will allow you to get a bigger lens on that as well, and also help you understand the relevance of all the services in our community and what they all do and how that we can all help each other, because, you know, we can't do everything in Deep Speak in Townsville. It's not possible. So, but we definitely know about services that do amazing work in different areas, and we think about those services and refer to those services for the client's benefit.
I think that's a great point to end on, in that we can do what we can individually, but we can do so much more when we link together and use each other. So Lauren, thank you so much for joining me on the podcast today.
My absolute pleasure. Thank you for having me.
Thanks for listening to Professionally Psyched. This podcast wouldn't be possible without the ongoing support of our psych community. If you'd like to show your support, or if you want us to cover anything on the pod, reach out via our emails, and don't forget you can listen to full episodes on Spotify.